Good mental health is not just the absence of mental illness, but also includes factors such as resilience, self-esteem, and the ability to navigate life's challenges effectively. In this short video, we go over why mental health is complex, how to build resilience, navigate risk and protective factors, and how impactful it can be on a global scale. Is there anything more complicated than the human mind and the mental part of it? Do we just flip a coin and decide what mood we are in or how we feel, or is there some sort of explanation and connection? Mental health has many aspects, influenced by biological, environmental, genetic, and psychological factors, or a combination of those. We can refer to those as connections that can interfere with mental health. These factors interact in intricate ways, shaping an individual's mental health and well-being. Let's look at the value behind the factors. Biological factors can be health, diet, sleep, and age. Psychological factors can be beliefs, mental health diagnoses, perceptions, and addictions. Social or environmental factors can be relationships, family, culture, work, money, and housing. Genetic factors can be inherited diseases, illness. Those factors create a cycle we thrive in as mental health exists on a continuum ranging from optimal mental well-being to severe mental illness. Just as physical health exists along a spectrum, mental health fluctuates, with individuals experiencing varying levels of mental well-being throughout their lives. Depending on the circumstances of any individual at any time, they may find themselves at one point of the continuum and shift position as their situation improves or decays. Think of this spectrum as green to red. Health and emotions are things you can consider as self-care and are on the greener side of the spectrum, while injury and illness are things that are not controllable and require aid from professional care and are on the red side of the spectrum. For example, when we demand a lot from a person, it overwhelms our resources and coping abilities, and thus mental health could be impacted in many harmful ways, and that happens a lot in our lives. This means we are moving from green to yellow. It can also depend on how well other parts of our lives are going, or how supported we feel, which can help us thrive back to a greener area. So in conclusion, experience and coping abilities affect our mental health and influence how we think and respond to situations in our continuum. By now, we know mental health is complex with surrounding factors, and it exists in a continuum where ups and downs cycle. But is there something that helps us cope with it? Resilience refers to the ability to bounce back from adversity and cope with all challenges effectively. Resilient individuals often have strong social support networks, healthy coping mechanisms, and a sense of purpose or meaning in life, which help them navigate difficult circumstances. If you can successfully adapt to life tasks in the face of social disadvantage or high levels of adverse conditions, it is considered a good or even strong resilience factor. Don't forget other factors like optimistic realism, responsibility, planning for the future, solution orientation, social relationships, self-awareness, and acceptance. Now let us talk about risk factors that occur in mental health. Certain factors can increase the risk of developing mental health disorders like traumatic life experiences, chronic stress, genetic predisposition, substance abuse, and socioeconomic disparities. Understanding these risk factors can inform us about prevention and intervention efforts needed to remove, reduce, or help to cope with them. Risk factors can be homelessness and unemployment, alcohol and other drug use, discrimination and racial injustice, family conflict or family disorganization, stressful life events. Conversely, protective factors can promote mental health and resilience, mitigating the impact of risk factors. Examples of protective factors include supportive relationships, access to mental health care, healthy coping strategies, and a sense of belonging within communities. I advise you to pay attention to this part as they can reduce your risk factors. Physical activities that can help are gym or sport. Emotional support can be friends, colleagues, family. Social activities can be talking, sharing, communicating well. Skill development factors can be hobbies, work-related skills. Proper nutrition can be eating a variety of foods, a healthy diet, adequate sleep, and therefore quality sleep. Also think about how related they all are and why it is important to pay your attention to them. Now that we have gone over the complexity of mental health and what are the risks and how to counter them, why is there still this stigma around it? Well, not understanding mental illnesses can lead to a stigma that creates significant barriers to seeking help and receiving adequate support. Usually, it's the feeling of shame, isolation, and discrimination, further increasing mental health challenges for individuals and even communities. Here are some examples to help break the stigma. 1. Educate yourself about mental health. 2. Share real-life examples of people with mental disorders. 3. Explain that mental health has a range of symptoms. 4. Listen and support others with mental health concerns. 5. Share stories of overcoming mental health disorders. By educating, you are already supporting yourself and can take or help take steps toward treatment. Mental health disorders are treatable and recovery is possible with appropriate interventions. Treatment options may include therapy, lifestyle modifications, support groups, and holistic approaches that address the mind-body connection. Steps can be taken to prevent and promote mental health importance and reduce the incidence of mental illness through early intervention, education, and community-based initiatives. Strategies may include stress management, resilience-building programs, and mental health education in various places. But prevention is not easy, since mental health intersects with various aspects of identity, including gender, race, ethnicity, sexual orientation, disability, and socioeconomic status. Ignoring a problem doesn't make it disappear. It will root it and make it harder to solve in the future. Truth is, mental health is a global public health issue with significant social, economic, and health implications. Mental health disorders contribute to a substantial burden of disease worldwide, affecting individuals, families, communities, and societies at large. That's why prevention is already a necessity, because a large amount of people worldwide suffer from a mental disorder. We can already see the loss of productivity and creativity due to the fault of two of the most common mental disorders: anxiety and depression. The takeaway from this is that human mental health is complex and dynamic and has many dimensions. Understanding the importance of it and learning about the factors that influence mental health, promoting resilience and protective factors, addressing stigma, and expanding access to care are essential components of promoting mental health and well-being for all of us. I encourage you to go over related videos like this to help you learn more about yourself and as well as others. Thank you for listening.